As age increases, the prevalence rate rises. Over 50% of men over 50 and over 90% of men over 80 suffer from this condition. Benign prostatic hyperplasia, BPH, commonly known as an enlarged prostate, is an increase in the size of the prostate gland that compresses the urethra, making it difficult to pass urine. The frequency of the disease is directly proportional to the patient's age. So, is there currently any method to treat an enlarged prostate without surgery? Let's explore this content with me. If we look at non-surgical treatment options for BPH, there are essentially two approaches: medical therapy, medication, and conservative endovascular intervention. In medical therapy, patients use certain medications to reduce the size and irritation of the prostate. The goal is to decrease urinary frequency and alleviate difficulty urinating. However, effectiveness depends on the individual. Some people cannot use these drugs, or prolonged use may cause specific side effects such as common side effects related to male physiology, sexual dysfunction, including decreased libido and erectile dysfunction, difficulty getting an erection, ejaculatory disorders. The amount of semen ejaculated is less than normal. Gynecomastia, enlarged or painful breasts. Some men may experience swelling or pain in the chest area. Effect on PSA levels. This medication reduces PSA levels in the blood by about 50%. This can mislead doctors during prostate cancer screening if they are unaware the patient is taking the drug. Note, in a few cases, physiological side effects may persist even after stopping the medication, though the majority will recover upon discontinuation. Besides side effects related to male physiology, patients may also experience headaches, back pain, muscle pain, hot flashes, indigestion, and acid reflux. Although most side effects are mild and manageable, there are cases where patients cannot continue the medication. Severe hypotension, low blood pressure, causing fainting or falls, especially dangerous for the elderly. Drug allergy, rashes, itching, shortness of breath. Severe psychological impact due to prolonged decline in sexual function. Next is the conservative endovascular intervention method, specifically prostate artery embolization, PAE. PAE has been performed globally since around 2010, meaning it has been in use for over 10 years. This is now a routine technique. PAE is a minimally invasive method where the patient retains full physiological function while improving symptoms of difficulty urinating and frequent urination. Prostate artery embolization is indicated for all patients with an enlarged prostate and clinical symptoms. If the prostate is enlarged but there are no clinical symptoms, treatment is not required. Clinical symptoms include nocturia, frequent night urination, dysuria, difficulty urinating, incomplete bladder emptying, and intermittent urinary stream. Additionally, patients with BPH who have concurrent conditions, such as those with coronary stents taking anticoagulants, blood thinners, or elderly patients, can also undergo PAE. This procedure does not require general anesthesia, only local anesthesia is used, and there is no pain during the procedure. The advantage of prostate artery embolization is that it is a conservative treatment, thus avoiding all the complications and risks associated with surgery. For example, surgery can cause bleeding, urinary incontinence, erectile dysfunction, or retrograde ejaculation. So, what should you eat and what should you avoid if you have an enlarged prostate? The first food group I want to mention is bell peppers. Bell peppers are very rich in vitamin C, which is essential every day for an adult man. The second group is berries such as raspberries, strawberries, blueberries, and blackberries. These are all rich in antioxidants and contribute to inhibiting the inflammatory process of the prostate. The third group I want to talk about is legumes, beans. Beans contain high levels of isoflavones and glycinin, which help hinder the inflammatory process in the patient's prostate. The fourth group is tomatoes. Tomatoes contain a large amount of lycopene, a powerful natural antibacterial agent that helps eliminate bacteria in the prostate as well as the urinary system. Additionally, lycopene is known to help prevent the progression of prostate tissue into cancer. The final group I want to mention is healthy fats from fish, which contain a large amount of omega-3. Besides the 5 food groups to add to your menu, there are also 5 groups you should avoid or limit when suffering from BPH, as they can cause the disease to progress more severely. The first group is animal fats, such as products made from liver pâté, butter, and mayonnaise. The second group to limit is salt and sodium-rich foods. The third group you should limit is red meat. According to some studies, if a person consumes a large amount of red meat daily, the risk of developing BPH increases threefold. The fourth group I want to mention is milk and dairy products like cheese and ice cream. This group can cause hormonal imbalances in men. The fifth group you should limit is spicy and hot foods, as they can irritate the bladder, causing overactive bladder conditions and making urinary symptoms worse. If you found this useful, please share it so everyone can know. Thank you for watching and see you in the next video.